Aloha, good morning. Welcome to the COVID-19 Care Conversation, sponsored by the Hawaii Executive Collaborative. Good morning, Ryan. I'm Yanji Denise, and we have a very special guest with us in just a few minutes.
That's right. Good morning, Yanji. Good morning to all of you watching. Thank you for tuning in. Joining us in just a few moments will be Senator Mazie Hirono, who's going to talk a little bit more about some of the efforts that's happening right now in Washington, D.C., as well as give us an update on some of the things happening on a national level and the urgency that's happening there. So we're excited to talk to her. We encourage all of you who are watching to please enter your comments, your questions for the senator. We'll get to as many as we can and sort of keep you engaged in this conversation as we continue to talk about all things COVID right here on this COVID Care Conversation.
Yeah, and good morning to Brandon, Adam, and Jana. I love that I see these familiar faces, these names every morning. We know that we've got some pretty loyal folks watching. Thank you so much. Share this video on your page. Get the word out that this conversation is happening. This is really your forum to engage with leaders in our community, to talk to experts, and talk to the people who are making these decisions on our behalf. Right now, we had some good news yesterday. As of noon on Monday, 5 new cases of COVID for a total of 604 positive cases across the state. That is one of the lowest numbers we've seen, Ryan, since this all began.
Yeah, and it is there was data that was compiled by Johns Hopkins University that shows that as of Monday, the state had the 3rd lowest per capita infection rate of any state. But a lot of officials are saying, as we've heard, and experts, that it's too soon to let our guard down. They worry about potential 2nd or 3rd wave of infection. So the state really trying to make sure that they can continue to keep those numbers low. Hawaii also ranks amongst the top 10 in states per capita, which suggests that Hawaii's infection rate may be more accurate than the rates reported in some other states. So some good news there as people continue to heed the warnings and stay home.
Yeah, it's amazing because a lot of people are so frustrated. They feel like there's not enough testing. But if you look at us compared to other states, we've actually got more testing per capita than so many. And we've got that low infection rate. So very good to see that. Of course, over 600 is still way too many, and we're hoping that we can get that down to 0. And to help us do that, of course, we want to talk to Senator Mazie Hirono. So let's bring her in. She's joining us today from Washington, D.C. Her office is there. Thank you so much, Senator, for being here this morning. How are you doing?
I'm not sure that she can hear. Senator, can you hear us?
Yes, I can.
Okay. Good morning.
Good morning.
How are you doing there in Washington, D.C.?
Well, we're all hunkered down, and my entire staff is teleworking, as is everybody else's staff, and we're doing our very best to continue to be responsive to our constituents.
That's great. I think what is happening is Yanji, I'm not sure that she can hear you, but
okay.
I think she can.
So I'll refresh and I'll join you in just a second.
You're kind of going in and out, but we'll do our best.
Yeah, so Senator, I'll start off with the first question to you. We've seen, first off, on the national level, that we saw that large wave of stimulus package that was passed, and that we began slowly seeing some of the people receiving that payment, those first rounds of checks. But there are still people that are still waiting for that payment. Is there any update on when those payments will start trickling down to the people and residents of Hawaii?
Well, just as you say, those checks are coming out, but probably not fast enough for all of the people who are waiting for the checks. The IRS is putting out some information, especially for people who don't normally pay taxes. They can go to the IRS website to find out how they can apply for the individual cash payments. And then I think it is this week that the IRS will put out information on how you can track the payments that should be coming to you. So, it's taken some time to get all of this going. And as I mentioned to you earlier, Ryan, that I and a lot of the Democrats in particular, and I'm sure the Republicans too, that there's a sense of urgency about what we need to be doing to get the assistance out to our workers, to our families, to our small businesses. And that's not quite rolling out the way we would like it to. And there's also a tremendous lack of transparency as to who's getting this money. Let me just mention one area, of course, that I know is of interest to our small businesses is that the COVID-3 package had $350 billion for PPP. That's to support small businesses to help keep them going. And of that, some 250 billion has already been processed. But I recently found out only about an hour or so ago that in Hawaii, there have been about 8,500 loans under this program approved in the amount of about 1.6 billion. Well, that does sound like a lot, but out of a whole package of 350 billion, we want to know and be assured that that money is going to the small businesses and to the underserved communities that we want that money to go to. So that's what I mean about the lack of transparency and where this money is going. And so before we approve another infusion of money for small businesses, which of course I support, we all want to make sure that there are parameters to where this money is going, to make sure it's going to the small businesses we want it to go to. That's just one aspect of COVID-3. And by the way, we don't call it a what is it that you referred to? it's we're going to need to do much more of a sustainable kind of a package going forward, I think, because all of our economies are going to be taking a huge hit, state economies.
What do you think that next package is going to look like? Where should resources be focused in the next care package?
We're going to put more money into the support for small businesses. And this is the 250 billion or so that the administration just wanted us to basically say yes to without knowing even where the first 350 billion is going to. We're also going to need to provide a lot more support for the healthcare providers. COVID-3 had 100 billion, but we know that they're going to need more, probably at least another 100 billion. So for the healthcare providers, they're going to need more support. I think that the COVID-4 should also have support for states and county budget shortfalls. There's going to be a huge tax shortfall, tax collection revenue shortfall for the state and the counties, and we should provide support to keep government going. And we want to make sure that all the people who should have the healthcare that they need get that healthcare. And so one of the populations that I'm particularly concerned about getting the healthcare to them would be the COFA citizens, of which we have about 20,000. And they were inadvertently, in my view, made not eligible for Medicaid back in 1995 or so. And now this is a community that can come to any state that they want to without having a visa, because we have military compacts with their nations. They should be provided with health care. And that's one of the things that I have been pushing for a while. And I hope that that can get into the next COVID package.
You know, I want to go back to the PPP plan, because we know that there are a number of businesses that actually applied for that here in Hawaii and are still waiting word. They haven't heard word from the lenders. They haven't heard any confirmation. What would you suggest those people, those small businesses that are hanging on to their employees because they recognize that's a part of the package, is to be able to sustain those employees and that payroll? What would you advise to those businesses that are still waiting to get any word from these lenders and from the SBA?
I'm told that there were some 20,000 or so applicants for these loans, and about 8,500 have been approved for a total of about 1.6 billion. I certainly hope that there will be more approvals coming for small businesses in Hawaii. It's taking longer for this program to be rolled out because the Treasury Department and the SBA didn't even have any of the guidance. And when they did put out the guidance, I know from talking to the banks and financial institutions in Hawaii that these guidelines were confusing. So that led to further delays. So the rollout on the PPP program was not what it could have been. It's one of the areas that we would want to address in the next COVID package. But what I can say is that because this was a first come, first served program, I am asking the Treasury, well, how much of that was flagged out for states? How was the fair distribution, if it was fairly distributed? And so people who are waiting can, of course, contact my office. And I think my state number is on the comment portion of this transcription or this program, I should say. So you should call my office and we will certainly do our best to help get you the information that you need.
It's hard to think about how we restart Hawaii's economy. Hawaii's economy really is sort of two economies. It's the tourism economy and then everything
Yes.
else. When we are looking at how to jumpstart that, what can the federal government, what can your side do to help Hawaii? How do we, how do we renew our economy while at the same time, we don't necessarily want all those people flooding in. So how do we help to restart everything else?
This is going to be a sustained process because all of the healthcare providers and medical people say that this could be an 18-month kind of a process. That doesn't mean that our entire country is going to be shut down for 18 months. But first and foremost, we should remember that this is a healthcare issue. And it's going to take another so many months, a year or so, before we can develop a vaccine or develop the kind of tests for antibodies that will help us. So first and foremost, it's a health issue. We do not have all of the tests and the rapid tests that we need yet. So that's something that we should have provided. We've been calling on the president to have a national call for these test kits so that we know how much this virus has spread to in our state and to any of our communities. But we need to get the health issue under control first, and then yes, we are going to need to provide stimulus. Actually, COVID-3 was not a stimulus package. It was more like let's just try to maintain things, but we're going to need to provide pretty large, I would say, stimulus package to get the economy going. And that would mean once we get the healthcare issues addressed adequately, then you are going to see resumption of tourism to states like Hawaii and Nevada. And you're going to be able to have some other kinds of economic activity. I certainly want to have a huge support for infrastructure, for example. I think this is a really good time for that kind of stimulus to be passed so that we can employ a lot of people in terms of construction and infrastructure needs.
We want to take a question from a viewer. One of the things that we're seeing, of course, are people just struggling to put food on the table. A question from Terry coming in and saying, is there anything that can be done from the federal government to help get more food into the food banks? We saw a long line of thousands of people just show up at Ala Moana Center this past weekend to get food supplies. People are struggling to put food on the table at this point in time. Is there anything that can be done on a national level that can maybe assist with this?
One of the major food programs is the CHIP program and food stamp programs. And so, yes, we would like to have much more money go into those programs. And it was not a priority for the Republicans. And I'm not trying to make this up a partisan issue, but it is a fact that the COVID-3 package would have been much more focused in supporting big businesses and corporations rather than the workers and the small businesses that the Democrats negotiated and fought for. And so the next package will focus still very much on the needs of our workers, our families first. And yes, we need to increase the support for food stamps to a great degree. And we want to make sure that the lunch programs at our schools are able to continue. There's a whole array of support that we can continue to provide, or should be providing, I should say.
The governor has issued the stay-at-home lockdown till April 30th. From where you sit, how long do you think Hawaii should stay on this stay-at-home order?
That is a decision that should be made on facts and science and what the healthcare community, what the doctors and the professionals are telling us. This is a pandemic, and it is a health issue, and particularly for vulnerable communities such as the homeless, such as the seniors, people with pre-existing conditions. So, you can't responsibly talk about opening everything up without a full understanding of what the ramification might be for the health and safety of our people.
In a crisis like this, it's really important to have, of course, access to healthcare. And can you tell us a little bit more about the efforts to expand Medicaid for the FAS citizens, those maybe who also without coverage? What happens to those folks who don't have coverage and don't need federal help in those cases?
We already see the evidence that the people in our country who do not have access to healthcare, who do not have health insurance, are the ones who are most hit, most affected, and they are the ones who are dying by greater numbers than the rest of the population. And this is why we have to make sure that the COFA citizens, for example, who got kicked off basically of Medicaid coverage, can resume that coverage. And I'm hopeful that we can get this into the next package so that everyone who should have health insurance, which in my view is everyone, because healthcare is a right, not a privilege, that the homeless community, we need to provide more support. There was some funds for outreach and support for the homeless community, but it wasn't enough. We're going to need to do more, because this is a virus that is going to take hold in places where there's not adequate medical or health care being provided.
On a personal level, I know that you are, working from home, as you said, your staff is working from home. What is it like to manage this and to actually be a lawmaker in these unprecedented times?
As far as the Democratic caucus, we just had basically a 1 or 2 hour caucus. So we all of the Democrats are on the phone. We ask questions. We do follow up. We're still putting together bills that would provide support. In fact, I have bills relating to the kind of support that we need to provide for our immigrant communities who should have access to healthcare and the money payments, et cetera, but there are language barriers and other kinds of issues that particularly impact those communities. And so bills are still being written. Work is still being done. It's just that we are not physically voting on these bills at the moment. There are lots of discussions and outreach taking place. And of course, my office is available to help, even though we're not physically there, but we certainly hear the phone messages, et cetera, and we follow up on those. So we're doing our best to get the job done. But until we can get hold of this pandemic, I continue to emphasize this is not a political issue; it's a health issue. And until we get control of that, it's going to require really a judgments based on what is best for the health of our country and our communities and our states before we can begin to reopen, and get back to life in a somewhat normal way.
How soon do you expect that next care bill to be passed? I mean, what's time frame are you looking at right now?
As far as I'm concerned, the sooner the better. But again, it requires basically the Republicans to come to us and negotiate with us. We had our own COVID-4 package that we put forth about a week or so ago, and that package continued to focus on workers, small businesses, our communities, and we need to come together because that's what it took to get COVID-1, COVID-2, COVID-3 passed. Those were all bipartisan bills. For the Republicans to take the position that they're just going to ram through whatever it is that they want is just not going to work. And so this is what it's going to take, and we're doing our best at this moment. Chuck Schumer continues to encourage or to put it to Mitch McConnell, the Senate leader, that we should come together and negotiate in a bipartisan way. And that's what should be taking place right now.
All right. Well, Senator, we know that you are busy, and we certainly appreciate you taking the time to join us. Any final thoughts that you have that you may have for those who are tuned in, the residents of Hawaii? Your final thoughts, maybe, about this issue that's happening.
The important thing is for everyone to remain safe and to take care of yourselves and others, to be kind to each other. And I wanted to give a shout out to those businesses that are doing things such as paying for food that people order on a takeout basis to help with to help restaurants. There are other groups coming forward. I think the United Way is putting together a rental assistance program, and so this kind of a situation really brings out the best in a lot of us. Unfortunately, it doesn't bring out the best in all of us, but I want to extend a thank you to the healthcare workers and the first responders, because they're out there totally risking their lives every single day, not just in Hawaii, but all across our nation. And I also want to let's face it, this is a time when we really are thankful that our supermarkets are open so that they're exposing themselves. We have our mail carriers. We have all kinds of people that do not get paid very much money, but we should appreciate them always, but particularly at a time like this, we should recognize that they should be getting the support that they certainly deserve. But the main thing is for everyone to stay safe. Thank you.
Thank you so much.
Thanks for joining us here.
Aloha.
Senator Mazie Hirono joining us from Washington, D.C. We see a lot of comments there, and we welcome all of them. Please let us know who you'd like to hear from next. Interesting, I think one of the big points there is the issue, Ryan, of oversight and the lack thereof. There is this big push to really get all this money into the states. But where is it actually going? And that's sort of the next piece. But, they don't want to slow it down. We need that relief. So there is this definite push-pull when it comes to that issue.
Yeah, and it's interesting to hear her saying and talking about the transparency and trying to figure out how are they deciding what states get money and how are they allocating it to each of these states. So trying to figure out where that's coming before and where that's going, essentially, before maybe introducing another package with more support. I think they're trying to really right now just get money into the pockets of these businesses and these residents who need it most. And there seems to be a little bit of backlog, but that she's saying that they're continuing to work to try to find answers and get a clear-cut understanding of where that money and how that money is being distributed.
We did see her office writing in the comments her contact information, and we'll be sure to update the show description so that you'll have her office accessible right there. Her staff does continue to answer emails and questions and phone calls, so be sure to reach out to her if you have a specific question that you think that the federal government can help you with that you are expecting from your representative. We want to shift gears back to the headlines here in Hawaii. Mayor Caldwell says fabric stores are now considered essential business. They will reopen on a limited basis. We saw a big backlash when he had ordered those folks to close down. We know a lot of you are making masks. You need your fabric. You can buy it online. There's 3 ways to purchase. Online, you can place an order like a to-go order, and they will bring you the fabric to your car. Fabric stores can also let folks in, but only 2 at a time, and they don't want any lines out the door. So they're asking that you wait in your car. I know every store will be different on how they actually roll this out, but fabric stores are now essential. They are back in business, so you can go out there and make your masks.
And also announced yesterday by Honolulu Mayor Kirk Caldwell, it was the enforcement of that curfew and what would happen. Of course, we saw over the Easter weekend that here on the island of Oahu, there was a 11 p.m. to 5 a.m. restriction that was in place for that 3-day weekend over Easter holiday. And the mayor saying that they will no longer, deciding that it was a success. They accomplished what they needed to do, and that he doesn't foresee them having to use that anymore. So the curfew that was in place over the weekend is something that they are not looking to bring back. However, they did reiterate the importance of staying home. HPD Chief Susan Ballard also got very passionate about people who are continuing not to take this seriously and having friends over and hosting parties, and that HPD would continue to do all they can to enforce amongst, trying to do the daily business of trying to maintain and keep our roads and keep everyone safe. They're now having to enforce this stay-at-home order as well. So a lot on their plate going on right now as well.
Yeah, and you see public officials really pleading with the public to stay in place because we are seeing those numbers go down of new cases, and that is so encouraging, but we need to keep it there. So to do that, of course, we all have to stay home. And if you do go out, wear a mask. If you're wondering, there's a really great article in today's paper, a user's guide to face masks, and it's all about different kinds of masks, how to wear one, how to get the right fit, who should be wearing one and when, also talking about kids and how to get them to wear them. So we invite you to check that out. It's really comprehensive, a great article there in the paper today. We also want to talk about our Hawaii hero today. It's First Hawaiian Bank, Ryan.
That's right. So First Hawaiian Bank is trying to help and support some of our small businesses, including, more importantly, our restaurants. So they are launching the Aloha for Hawaii initiative, and it's a program really aiming to generate 1 million takeout orders at Hawaii restaurants. as well as to provide up to $1 million in donations for this new sort of fund, this Aloha for Hawaii fund. And so how it works is that you can use your FHB debit or credit card to make purchases at a takeout meal in Hawaii. And each time that the card is used at any of the Hawaii restaurants, First Hawaiian Bank will actually make a donation on the customer's behalf to the Aloha for Hawaii fund that supports selected charities. So trying to find a way to not only support the businesses by encouraging people to go out and eat, but also donating to this fund as well. So we want to mahalo and recognize First Hawaiian Bank for their efforts as our Hawaii hero today.
Yeah, and what's cool about that also is that you don't need to keep track yourself. The bank is doing all the legwork on that, so you don't need to write in receipts or do anything. They will make that donation. So good to see them helping out there. Another organization that's really helping out is the YMCA. They're doing things on a number of fronts, but we did want to highlight what's happening on Maui. The YMCA in Kahului is offering free supper and snacks to go for the first 100 keiki 18 and under. That's from 5 to 6 p.m. every day, or Monday through Friday rather, at the Kahului YMCA. If your kid can't be there, they totally understand there. You just need to bring official documentation to show that this is going to a child in need. So that can be a school letter, an individual report card, birth certificate, student ID, whatever, to show that there is really a child in your household. So you can learn more, mauiymca.org. Just wanted to highlight that because they are giving away 100 meals every day for kids in need.
That's right. And then we also know that there continue to be needs for masks, and the EMS officials, there actually was a call out yesterday that we put on here. We're going to list their contact. So the EMS team actually needs masks. Of course, they're using the PPE sort of equipment when they go in and have to do the official business, but it's in between those times that they need some of those cloth masks. So if anybody's willing to donate some of those masks, we have the email there of Shane Enright, who you can email and get connected with, and they will take any additional face masks that you may have to help support them as well.
Yeah, and that doesn't matter if it's 1 mask or 100 masks. They need a little over 200. So, and any amount is very, very helpful. So if you have a fabric mask, get in touch with Shane. And I apologize. I don't know. I don't know how to turn this phone off. So, but I will make sure that tomorrow they're all unplugged. I apologize for that. That is the
beauty of working
the new reality of working from home, isn't it? You can't always control the circumstances around you. The good thing is that my kids are in a different part of the house.
They're locked in a different room.
We know a lot of you are struggling as well. Hey, we also want to let you know for the parents who are watching that Dr. Christina Kishimoto is joining us tomorrow. We know a lot of you have questions for the superintendent. So we're really looking forward to having her on. You can ask your questions about school reopening, about graduation, whatever you have. We're going to have her on. She'll be here 10:30 tomorrow. So make sure to tune in for that.
That's right. Be interesting to hear more about that sort of 4-week ruling that they sort of put in place when the schools would open up. So we're excited to talk to her. We also have Lieutenant Governor Josh Green coming on Thursday as well. So that to look forward to. We know that in just looking at the comments here, still a lot of unemployment comments and questions that are coming in. We are going to have Scott Murakami back on next week. This will be his 3rd time. So I know some of you are asking for an entire show dedicated to that. We've already done 2, so we want to encourage you to go back and watch some of the other videos and shows that we've done on unemployment with Director Murakami. But again, he will be back next week. We will continue to keep you posted with exactly when and a schedule coming out for next week, as well as we can continue to build our schedule based on the people that you want to speak to. So want to ask you again, encourage you to go back and watch those videos or tune in next week to ask more of your unemployment questions then.
Okay, until then, we'll see you tomorrow with Dr. Christina Kishimoto. We appreciate all of you who are in compliance, who are staying home and staying the course. When we see those numbers coming out, we do see the curve is flattening. So keep doing what you're doing. We know this is difficult, but we encourage you to please stay home so that we can all meet in person again very soon.
Aloha. We'll see you tomorrow at 10:30.